We know that Americans are working until later and later in their lives. We know that Americans are having children older and older. And usually it's all under the assumption that everybody's living longer and we're going to continue living longer and longer. But recently, that has actually not been the trend. American life expectancy has been declining, and that's not exactly the pinnacle of successful and advanced nations, right? Sometimes life expectancy numbers can be misleading or at least confusing. Like, for example, if you decrease infant mortality and reduce the number of people that die before they turn 1 or 5, depending on how you measure it, you're going to increase life expectancy, but it doesn't really mean that people who make it to adulthood will live longer. It's just a number that's impacted by the reduction of infant mortality. But the data is genuinely getting worse for life expectancy in the United States. The US age-adjusted mortality rate rose 1.2% from 2014 to 2015, according to the Society of Actuaries. That is the first year-over-year increase dating all the way back to 2005, and this is a stunning number. This is only the second rise greater than 1% since 1980. Americans in their late 50s are having more serious health problems than people in their late 50s did 10 or 15 years ago, despite advancements in treatment for many conditions. Quality of life is down. The number of middle-aged Americans with activity of daily living limitations is up from 8.8% to 12.5%. Now, what does that mean, activity of daily living limitations? That is a measure of how many people have trouble with day-to-day activities like walking across a room, bathing and dressing by oneself, eating by oneself, getting in and out of bed by oneself. And we're also seeing that it's not just physical, but cognitive skills have been declining over time. For those with a retirement age of 66, 11% already had some kind of dementia or cognitive decline by age 58 or 60, according to the study, and that is also up. But the policy still is moving as if life expectancy is going up. So, for example, the age for claiming full Social Security benefits is being increased from 65 to 67 by 2027. That might make sense if people are living longer and longer, but we're seeing increased mortality rates. Retirement is being postponed. 20% of Americans in their early 70s are still working now. That is a number that's on the rise. That would make perfect sense if people were living longer and longer. It's not what we're seeing. And I've talked about some of the causes, at least among middle-aged white people who are having problems with life expectancy. Some factors include alcohol abuse, drug overdoses, suicide, higher rates of obesity. But there are many other factors. Lack of exercise, which I guess correlates or is related to obesity, is a factor. Processed foods, environmental pollution can't possibly be helping. The stress caused by huge debt, sometimes for people's entire lives, based on credit card debt that is accumulated as a result of student loan debt, which is a major, major crisis in the United States. And you know who lower life expectancy is good for? Pension plans. Plans of different kinds that are defined benefit, that are committed to sending recipients money for as long as they live. If people don't live as long, that's good for the pockets of pension plan companies. And really, I think we need to be having, I don't know if conversation is the right word, but a sort of intervention when it comes to the culture of busyness, as I call it, and the culture that has developed in the United States. And it's become work, 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 and then drop dead, but enjoy the freedom that we have in the United States, I guess, to do whatever you want, as long as you're working all the way up until you die. And I can start picking out little things we can change. Oh, reduce the work week by a few hours, or let's try to deal with student loan and college costs. All are worthwhile endeavors. But this broader status quo is inherent to the economic system we live in. Now, you might hear that and say, oh, there you go on your socialist rantings. I'm not a socialist. I'm not advocating for socialism. But we need a different type of capitalism, something more like the Scandinavian model. It's just the reality, because a lot of the problems we're experiencing and the life expectancy issue connects to that. We can't do piecemeal changes. The system really has to be overhauled, and there's no indication that's going to happen anytime soon.